beautiful people, this is Miss Regina. Welcome back to Break the Sickle Cycle. On today's episode, we are going to be talking about how the sickle cell disease affects the normal body function and how individuals inherit the sickle cell disease from their parents. And I'm doing this with
Anita, an advocate for sickle cell disease.
So stay tuned and let's get interrupted. Pathophysiology is a medical term which means the disordered physiological processes that are associated with a disease or a condition, or in other words, how a disease affects the normal body function. In our previous episode, we discussed about hemoglobin as the protein containing iron of the blood and the types of hemoglobin that we have. Today, I am talking about how inheriting the abnormal hemoglobin X will affect the normal body function. Red blood cells assume the sickle or the crescent shape with the low oxygen saturation due to the presence of the abnormal hemoglobin S. These sickle-shaped red blood cells are rigid and they have the tendency of blocking capillaries. Capillaries are the smallest blood vessels where gaseous exchange takes place. This further reduces the oxygen saturation of the red blood cell and further causes more sickling of the red blood cells. Low oxygen level and repeated episode damages these red blood cells and reduces their elasticity. However, they fail to return to their normal shape even if oxygen saturation are restored. These rigid red blood cells are not able to change shape when they pass through the narrow capillaries, leading to blocking of the vessels. When the vessels are blocked, it means blood supply to various tissues are cut off, which causes the tissue to damage, known as ischemia. Ischemia is the damage of various tissues inside the body due to inadequate oxygen. When there are repeated episodes of these, the tissues undergo tissue death, known as infarction. Anemia also happens, and this happens as a result of excessive destruction of these red blood cells in the spleen because of how they are shaped. And then again, normal red blood cells have a lifespan of 90 to 120 days, but a sickle red blood cell has only 10 to 20 days. This means people with the sickle cell disease almost always have anemia.
If you're going to talk about the genetic inheritance of the sickle cell disease, what do I mean by that? When a mother is AS and a father too is AS, that means they both had a sickling trait which is being recessive. There is a probability that the kid that they will give birth to might be either sickling positive because they have 25% chance of giving birth to a child who is sickling positive. The remaining 75%, 25% of it is where the child may not even have the sickle cell trait at all. The remaining 50%, that's when a child may be a carrier but in a recessive way. AS and AC, it happens the same way. SS and SS is not compatible.
How does individual inherit the sickle cell disease from their parents? Each individual has two hemoglobins, which means one from the mother and the other from the father. So this represents two individuals who both has the sickle cell trait in their blood. So when you have the sickle cell trait, it means you have one normal hemoglobin and one abnormal hemoglobin. So when they are about to give birth, the father can bring the normal hemoglobin and the mother can bring a normal hemoglobin, which means this particular offspring is going to be healthy and will have no trait of the sickle cell disease. But these two children have the tendency of having the sickle cell trait because the father can bring the normal hemoglobin and the mother can bring an abnormal hemoglobin. And then again, the father can also bring an abnormal hemoglobin and the mother will bring a normal hemoglobin, which means these children are going to have the sickle cell trait in their blood. But unfortunately, when the father brings his abnormal hemoglobin and the mother also brings his abnormal hemoglobin, it means this particular person is going to have two abnormal hemoglobin, and this particular person is going to be a sickle cell patient. And so whenever these individuals are to give birth, they have 25% chance of getting AA baby, and they have 50% chance of getting AS, and 25% chance of getting a sickle cell baby. But then these actions are not controlled by the individuals. There are involuntary actions which happens on their own. So you can give birth to 4 children and they will all be SS. You can give birth to 3 children, they will all be AA, and you can give birth to 10 children, they will all be SS.
Mother and father, please help us. Let's prevent the unborn child from contracting this disease, because the pain and the trauma associated with this disease is unbearable. We can reduce this disease by conducting genetic tests before even preparing to give birth or getting pregnant. Let's all come together and reduce this sickle cell disease to the barest minimum. Thank you.
This brings us to the end of today's presentation. Thank you all for watching, and see you on our next episode. Breaking the sickle cycle, protecting the unborn children.